Good evening, everybody, and welcome to this month's meeting of the Customer and Corporate Services and Scrutiny Management Committee. Just before we get started, I'm going to briefly tell everybody how the meeting will work and introduce everybody. So I think we're all quite familiar now with the general mechanics of these meetings. I've asked everybody to keep themselves muted when they're not speaking. If people want to ask a question or make a comment, I've asked them to raise their virtual hand within the Zoom meeting, which I can see as chair, but isn't always visible to the members of the public watching, but I will take people in the order that I see them raise their hands. If anybody is wishing to make an additional point, a supplementary point on the item that's being discussed, if you just raise your physical hand and I will bring you in if it's appropriate to do so. If I could just remind everybody that these meetings are broadcast live and they're recorded and uploaded to YouTube for posterity. So just keep that in mind when you're making any comments, and if you could keep yourself in shot at all times throughout the meeting, that would be great. So you can see at the moment all of the members of the committee on the screen. We're also joined by Janie Berry, who is the Director of Governance and is the Council's Monitoring Officer. And we've got Dawn Steele, who is the Head of Civic and Democratic Services. We do have technical officers in the can't speak this evening. Technical officers in the background who are assisting us and who we shouldn't hear from, but occasionally if something goes wrong, a voice may come over the ether telling us what to do. And we will be joined throughout the meeting by various different participants at the different stages of the meeting. And as they join us, I will be introducing them. I'm looking to try and get through the bulk of the agenda in a fairly good go this evening, and then we'll be taking an adjournment a little bit later than I normally do, just to manage the way that this evening's meeting will work. And that adjournment may be slightly longer than normal. I always do try and take a 5-minute break just to give everybody's eyes a rest, but we've got a particular item this evening that we just need to manage in a slightly different way. And so what we'll do, we'll work through the bulk of the agenda. We'll get right the way through the work plan and the urgent business, and then we'll come to item 9, which is the update on the community stadium. Now that item does have some confidential papers associated with it, and so if members are wishing to discuss any of those items, we may need to move into private session before we can discuss those particular aspects of that item. So what I'm planning to do is move us all the way through the meeting, take the adjournment, then just before we come back to agenda item 9, I'll be seeking members' views as to whether or not they feel they need to go to private session, and if we do, we'll move into private session at an appropriate point whilst we're discussing agenda item 9. So hopefully that makes sense, but I'm sure that Dawn or Janie will keep me in line as we get to that point. I've received 2 apologies for this evening's meeting. Councillor Kilbane is being substituted by Councillor Callum Taylor this evening, and Councillor Mason is being substituted by Councillor Daubney. So the first main substantive item of business is declarations of interest. If anybody has anything that they wish to declare, if you could indicate now. Not seeing anybody, so I shall move us on to agenda item 2, which, as I mentioned previously, is the exclusion of press and public. What I propose to do is, rather than deal with that right now, I'll deal with that immediately before agenda item 9. So if members, as I say, are wishing to bring anything up that is within the confidential papers, we will then have provision to be able to go into private session. On to agenda item 3 then, which is the minutes. You should have a copy of the minutes for the meeting held on the 9th of November. I have no comments on the minutes. If anybody has anything that they wish to comment on, otherwise, are you happy for me to sign those as an accurate record? If I can just see a wave of a hand or a thumbs up. That's great. So rattling through, agenda item 4 is public participation. We don't actually have anybody registered for public participation. So straight on into agenda item 5. We're halfway through the meeting already in record time, and that takes us to the public health update. So if I could invite Sharon Stoltz, who's the Director of Public Health, to join us. Good evening, Sharon. And I think you have a presentation that you can give us to give us an update on some of the regular questions that this committee's been asking each month. And once we've had that, I'll ask members to ask for any questions that they may have. What I did mention to Sharon earlier is that I'm conscious that we're having these regular updates and they're very, very helpful, but we're often sort of covering similar ground. So we've tried to give a set of key questions that we'd like answered in the presentation. So I'm hopeful that we can move through this item in good time, because we do then have quite a lot of other things on the agenda this evening. So over to you, Sharon.
Thank you, Chair. I think, Robert, you're going to be Master of Ceremonies this evening. If you can take us straight through to slide 3, please. So that's this one. Yes, thank you. So this graph here illustrates what's been happening in terms of the number of cases that we've had in York since the beginning of the pandemic, back in cases back to back to February. And as you can see, we reached a peak of just under 450 cases on the 16th of October, which is around the time that we went into old Tier 2, just before the most recent national lockdown. And since then, our rates have been falling. As you can see, the rates across England, which is the dotted line, and Yorkshire and Humber region, which is the green line, have also been falling. But York peaked earlier and has fallen faster than the regional and national averages. So our 7-day case rate at the moment is 65 per 100,000 population. And to put that in context, the national rate at the moment is 149. And the Yorkshire and Humber region is 174. So you can see that our rate is significantly lower. So if we go on to the next slide, please. So this shows the rate of new cases that we've seen for people aged 60 plus. So we know that the Department of Health and Social Care pay particular attention to case rates with the over 60s that we know are most at risk if they are to catch COVID. And again, you can see the red line being York. We did see 2 small peaks there through October, early November in terms of our over 60 rate, but that's now fallen to 60.5, as it says there on the slide. And again, you can see that is significantly lower than the regional and national rate. So on to the next slide, please. So this shows our positivity rate. So this is the proportion of tests that are coming back as positive. So again, you can see York, the red line, we had a peak of infection around mid-October. We had one of the highest positivity rates in the region, and considerably higher than the national rate when we peaked at 18% there. But as you can see, our rate has come right down. And we've talked previously in these meetings about needing to reach a positivity rate of below 5%. And as you can see, we've achieved that. We now have a positivity rate of just over 2% there. And you can see the comparison with the national and regional rates. And we've also got the number of tests coming back as positive there. So out of 2,872 tests done, we've only seen 113 positives. And then just to say something about the lateral flow tests, members will be aware these are the new rapid tests that give results within about 30 to 60 minutes. At the moment, only the universities have access to these lateral flow tests. We should be receiving our first batch of these new tests as a local authority, we hope next week. But at the moment, they're being done by the university. And as you can see there, a low positivity rate there as well, which shows that actually we're doing really well as a city in terms of keeping our outbreaks down. and preventing the spread of the virus, which is, really excellent news. So on to the next slide, please. This really shows the number of tests for COVID that have been undertaken. So as you can see, numbers had fallen quite low, which fits with the figures that we just looked at on the previous slide. And the reason there's been that rapid increase is because of the thousands of tests now being done on university students, the new lateral flow test. So that's why we've seen that rapid increase there. So on to the next slide, please. These slides show, the top picture shows the number of people contacting NHS 111, either by telephone or online, with symptoms of COVID. And as you can see, those numbers have fallen considerably. The bottom graph shows how many people who are registered in the COVID symptom app. How many of those are reporting symptoms of COVID. And that's quite variable, as you can see, quite some peaks and troughs there. But again, since around October time, the general picture has been of a reducing trend there. So that we can be fairly confident then that our reducing numbers are a true reduction, because all of those indicators are heading downwards. So on to the next slide, please. This shows activity in York Hospital. So as you can see, we had the big peak in the spring, low activity in the hospital over the summer, and then activity started to rise again towards kind of end of September, October time. That activity peaked there, but as you can see, numbers are now falling. And it's important when we're looking at this to realise that not all of the patients in York Hospital will be York residents. So York Hospital takes patients from a wide area. So we can see there, we're looking at 34 people in hospital beds there, but when we've looked at this, only about a third on average are York residents. So again, a positive picture there. So on to the next slide, please. We've talked before in this committee about excess deaths. And as you can see, we saw a peak in the number of COVID deaths and excess deaths in the spring. Since that time, there's been a reduction in excess deaths. At the moment, overall, we're seeing fewer deaths overall this year than the 2014-18 comparison. The caveat to that is that the COVID deaths have started to increase slightly. There's always a time lag between people becoming ill with COVID, requiring hospital treatment, and then sadly dying. So as you can see, we've had 19 COVID-related deaths of CYC residents in the last 7 weeks. So that number slowly increasing. I hope that because we've seen overall rates falling, that we will start, and hospital admission rate falling, that we'll start to see a decrease in the number of people dying as well. But that kind of gives you the picture from the beginning of the year up to now. On to the next slide, please. This graph shows you the age brackets that we're seeing the case numbers in. And as you can see, the largest proportion of cases there is in the 50 to 59, 40 to 49 and 50 to 59 age groups. That has changed significantly to the figures we were looking at in early October, where we were seeing the majority of cases in the 20 to 29 age group. I missed out the 10 to 19 age group that is the highest in this list here. That is really reflecting the increase in cases we've seen in older teenagers. So we're not seeing that many cases in the younger age groups. Again, it's that 18 to 19 age group, 17 to 19, that we're seeing most of those cases in, but that gives you an indication. You've got the numbers there as well as the rates. So on to the next slide, please. This graph shows that our rates are falling across all age groups. So the grey line is the 15 to 34. You can see that rapid increase that we had there. And then now numbers are dropping across all age bands. So on to the next slide, please. So this gives you an update as to what's happening with care homes. We have done very well in York in controlling the number of cases that we've had in care homes. And most of the cases that we've been picking up have been through routine whole care home testing of staff who are tested every 7 days, and then residents are tested monthly. As you can see, the latest outbreak there was on the 25th of November there. And there's a little note there to say that there's been a recent outbreak reported by Public Health England, which doesn't fit with our local intelligence. So we're doing some further investigation with Public Health England to establish what's happened there. And then the most recent data for schools show there were 8 children across primary and secondary school age who have tested positive. And again, low numbers there compared to schools in other areas. And I'm very pleased to say that we haven't had any school closures in York. We've had bubbles of children and a couple of school years that have needed to self-isolate, but we haven't had any school closures, which I think is a testament to all of the hard work that our schools have done to ensure they're safe places for children to be. So on to the next slide, please. So we've talked in the past about university cases, and this slide I think illustrates quite well how we've worked as a public health team with both universities to bring those cases right down. So the orange line being York St John University, as you can see, their cases are way down there, just 2, the most recently reported. And York University also seeing a dramatic drop in cases there. So again, very pleased with the joint work that's been done with the universities to get those numbers way down. So on to the next slide, please. This shows a breakdown in the number and rate of cases in the different medium super output areas across York. So for quite a number of weeks, we were seeing Fulford, Heslington and University being the highest. Whereas as you can see there, if we look at rates, Haxby has the highest rate at the moment. But the numbers themselves are fairly low, which is why I thought it was helpful to put the numbers as well as the rates in, because it helps put it in context, I think, when you see that the numbers are actually not high at all across the whole of the city. So on to the next slide, please, which might be the last one, actually. This shows a little bit about what's happening with local contact tracing. Right, there's one more slide after this one. So committee members will be aware that we have launched our own contact tracing service a few weeks ago. That's been very successful, and as you can see, 100% of the referrals that have been passed on to the local team have been actioned. Most of those then we've successfully been able to contact. There are just 81 since we started local contact tracing that we haven't been able to reach. There are various reasons for that. It might be that someone is in hospital. It might be that we haven't been given the right telephone number for them, or it might be that when they just haven't answered the phone when we've contacted them. But wherever we have an address, a confirmed address, we are posting information and guidance leaflets through doors, including how to contact the local public health team and the social support and financial support that's available to people who are self-isolating across the city. So we've been able to follow each of those up. And then the next one is the last slide, which just basically shows that in a graph. So as you can see, the numbers of cases being completed through the national test and trace service weren't good. And since we've introduced our local contact tracing, the red line there, as you can see, those numbers have significantly increased, which is positive. And we have lots of case study examples from people that the service has contacted who have been very appreciative of the advice and support they've been given, and also understood better the need for them to self-isolate and exactly what that means. And I'm sure that will have had an impact in keeping our case numbers low as well. So I think that's the end of the presentation, Chair. I'm conscious that I haven't talked about vaccination or testing, so happy to answer any questions that anybody may have about that.
Thanks a lot for that, Sharon, and you know, thanks as always for all the work that you're doing. I'll open it up to members, and as always, Councillor Rowley was straight up with his hand. So over to you, Councillor Rowley.
Thank you, Chair. And Sharon, I'd like to thank you and your staff for the work that you've done in what has been probably the most difficult year to be in healthcare and any form of service related to it. Sharon, I've got a question, and I have professional knowledge on this, which I'm bringing to the meeting. I won't in any way break any confidences, but we have had, in the last 2 weeks, we've had 2 COVID positive people that have come to us. However, both of them died. One died of a heart attack, and one died of cancer. And because they were tested positive within 28 days of them passing away, that comes into the figures. I'm just curious, is there any way of filtering out the actual causes of death which are clearly not related to COVID to give us a more accurate figure?
Yes, we can do that. However, one of the reasons why deaths within 28 days of a positive COVID test are classed as COVID related is particularly with the cardiovascular one, is that could have been a side effect of COVID, if you like. We're aware that COVID affects the body in different ways. It's difficult to know with the cancer example whether COVID was linked to that or not. But what we do in public health is we look at the totality of deaths. So we look at the deaths that are recorded on the death certificate where COVID is either cause of death or mentioned, and they're in the COVID figures. One of the reasons we also look at all cause deaths is that it gives us a much more accurate picture of the impacts of the pandemic, if you like, that may be attributed to the pandemic in some way, even though COVID isn't actually listed on the actual death certificate. It's difficult for us to do the detailed work around that at the moment because we're busy dealing with a pandemic. But one of the things that we will do when we have more time is to go back and do an audit of all of the deaths that have occurred. So we'll be able to retrospectively have a much better understanding of those deaths that were as a direct cause of COVID and those that were indirectly impacted by COVID, even though it might have been within that 28-day period. But usually we need a whole year's worth of data and then the time to be able to analyse each of those deaths, which is something that we will do. So we'll be able to look back on that. It's just that we're not able to do it accurately just now.
Thanks, Sharon. Councillor Hunter.
Thank you, Chair. Thank you, Sharon, for all the great work that you're doing. My question's relating to students. What arrangements have been made for when the students return after the Christmas break? Because we noticed a peak before, and obviously, you know, residents don't want to see a peak coming again, particularly if students have been in sort of tier 3.
Yeah. So what both universities are doing is arranging for the students to come back with what's called a staggered return. So they're not all coming back at the same time. And it'll probably be closer to early Feb before all of the students are actually back. What we're doing, though, is having active discussions with both universities about how we can arrange testing for students before they come back to university, and then the testing that we can offer them as soon as they're back. So those are discussions that we're having now. What is different now to back in September, October, though, when we saw that peak, is we've learned a lot from that experience, so we're better prepared. We have more testing capability than we had back in September, and we also have our own local contact tracing service in place. And I must say that the universities have staff that have become expert contact tracers in their own right because of all of the work that we've been doing with them over the past weeks. So those, just to give members and also any residents watching reassurance that all of those plans are being put in place. And I think having that staggered return with some students having online learning and not coming back till kind of probably February will make a big difference in terms of that as well.
Thank you, Sharon. Councillor Daubney.
Thank you very much, Chair. Thank you, Sharon, for your presentation. And I think overall a very positive picture for the city and for our residents, whom obviously we're all very concerned about, particularly the more elderly ones. Is it the case that significantly better self-isolation compliance has caused York to be, well, our local rate to fall so significantly compared to the national rates? Because there's quite a significant difference now, isn't there? There's quite a widening gap between ourselves and the national average picture.
So I think it's a very fair question. I don't think it's one single thing that's made a difference in York. I think that what has been different to some other areas is that we've had a whole city approach. We've worked hard as a city to come together for, you know, the public health team, other teams across the council, colleagues in the NHS, schools, universities, businesses. You know, everybody's worked together with a very clear goal of controlling the pandemic, getting our case numbers right down. And part of that has been encouraging people to follow prevention measures. So, you know, the hands, face, space message. People by and large have been very good at following those messages. When you walk around the town, you know, the majority of people are wearing face coverings, so that's been very positive. You see people using hand gel, all of that will have made a difference. But we've also worked hard to respond very quickly whenever we've become aware of an outbreak. We've pounced on it and reacted very, very quickly to try and contain that. And support people with self-isolation, with financial support, and for those people who are of a low income, through the community hubs, through the work of the fantastic voluntary sector that we have in York. It's very much been all of those things coming together with our very clear goal and everybody working towards that shared vision, which I think has made a difference. And it hasn't worked in quite that way in some other areas. And obviously the size of York helps, because we're small enough to be able to have that very clear focus, I think, but large enough to be able to provide the support. So it's all of those things working together that's made a difference.
That seems an answer which very much says compliance plus partnership.
Yeah.
Thank you very much. Thank you.
Councillor Pearson.
Thank you, Chair, and thanks, Sharon, for your presentation. And I think the City of York's in safe hands when it comes to you and your team. I really do think that. I've got a question just about the lateral flow tests and whether you think there's been some concerns about them and whether you think they're giving any false impressions.
Yeah, so lateral flow tests are causing a fair amount of controversy at the moment, as I'm sure that some of you will be aware. Lateral flow tests are just one test, if you like. It's one tool in our toolkit for managing the pandemic. They are largely aimed at people who don't have symptoms of COVID, in order to give them some reassurance that at the time that test has been taken, they're not infectious. They don't replace the PCR testing that we already have in place. And I think it's important for people to understand that. Lateral flow tests are a very important tool for us to use, but they have to be used correctly. And what we know is that the accuracy of the test is very dependent on who actually is doing the test. So if a swab is taken by a healthcare professional or by somebody who is trained in how to do that swabbing and is trained in how to read the result, then actually its sensitivity and accuracy of that test is much better. Where we've seen more negative press is when tests are just perhaps posted out to people or given to people. They've only got the little leaflet that comes with the test to help them know how to do the test and how to read the result. And in those cases, we know that the sensitivity of the test is much poorer. And where that is a real concern is in care homes. And so we're having discussions at the moment with care homes around what we're going to do about these lateral flow tests. Do care homes want to use them? And if they want to use them, how are we going to train them to use them? How are we going to support them to use them? And then how we manage the communications, because a lateral flow test needs to be repeated. So it needs to be repeated about every 3 days. It's not a single test. And also it doesn't remove the need for wearing protective equipment. So even if somebody, a relative was visiting someone in a care home and they had a lateral flow test and that was negative, they would still have to wear a face mask. They would still have to wear an apron, PPE, etc. So we're working with care homes at the moment and working with adult social care and the communications team to try and help people to understand the pros and cons of lateral flow tests, and then crucially what our plans are in York to help relatives be able to visit care homes and hug and hold the hand of their relatives, which is something that we all want to see happening. So that's kind of where we are with lateral flow tests at the moment.
Thanks, Sharon. Councillor Taylor.
Thank you, Chair. Can you hear me all right?
We can, yeah.
Cool. Thank you for your presentation tonight, Sharon, and your comprehensive answers as ever. I wanted to talk about Christmas, if that's okay. We all like to talk about Christmas. Now, a lot of focus is given to the movements of students coming to and from the city, but Christmas time will see, you know, concentrated movements of pretty much everyone in the country, students or not. And I'm just wondering how the local public health team are feeling about Christmas. Are York braced for any sorts of difficulties in early January as a result? And are we prepared for them? And also, do you know if there's going to be a sort of uplift in enforcement over the Christmas period to make sure that the guidance that is put out there is followed? I'm assuming you're plugged into that side of the system to some degree.
Yeah. So if I take the last bit first, it's probably the easiest. Yes, there are discussions happening right now, actually, involving the police, the BID, the new rangers, you know, the COVID marshals. All of those discussions are already happening about Christmas, but also New Year, thinking about how we can get the right messages out to people about, yes, we all want to celebrate Christmas, you know, we all want to celebrate New Year, but actually we don't want to undo all of the hard work that everyone has done in York over the last months, and we don't want to see a third wave of COVID in the city either. So yes, those discussions are going on, and there'll be some further communication out around how that's all going to be managed. Some of it will depend on what tier we are in. So we know that the government will be reviewing the tiers on the 16th of December. They'll be reviewing them again on the 30th of December. So we don't know at the moment whether York will stay in tier 2 or whether we'll go into tier 1. So that will have some impact as well on some of those plans. From a public health perspective, if we put the economy to one side, because obviously the shops want people to be shopping in them, but if I just focus on the public health message, that is really a message for people to be cautious. Just because we can meet up with friends and relatives, it doesn't mean that we should. And we just need to be very cautious, I think, about risk, particularly to older people or any of our friends and relatives who might be living with long-term health conditions that might make them more vulnerable to the virus. And the importance of, you know, those hand space messages are still going to be crucial. So, you know, I don't want to be Scrooge. I'm planning my Christmas celebration, but it's just a cautionary note, really, for people not to go mad, but to still recognise that this is not going to be a normal Christmas. And yes, people need to be able to celebrate it, but, you know, don't go mad, be cautious. And just think of how dreadful it would be if we start to see a significant increase in cases once we get to January. So just a message of caution, really.
Thank you.
Thanks, Sharon. I've just got Councillor Fenton with a question, and then I'm going to bring this section to a close. So, Councillor Fenton.
Thank you, Chair. Sharon, could you set out briefly what role, if any, the public health team will have in the rollout of the vaccine, and whether we'll have an opportunity to promote, encourage take-up, and maybe tackle some of the misinformation that may be put about? Thank you.
So yes, public health is part of the group that is planning the rollout of the vaccine. And so we're involved with the local group, the North Yorkshire and York group, and the Humber, Coast and Vale planning as well. So we're at the centre of all of that. As a council, we've agreed to support the NHS with premises or whatever other support they might need. And in terms of practical support, we have a significant number of public health nurses within the council through our health visiting and school nursing service. So we've agreed to redeploy a proportion of our public health workforce to be trained to actually support the vaccination as well. So at the core of all of that, and our comms team within the council are already working closely with the communications team within the CCG and with GP practices around the messages that we need to get out to the public. So yeah, at this, so we're not leading it, the NHS are leading it, as you're aware, Councillor Fenton, but certainly it's seen very much as a partnership approach. So we're at the centre of all of those discussions.
Thank you very much, Sharon. I think they've been really, really helpful. I was poised to ask one last question about vaccination, and Councillor Fenton got in there with pretty much the question I wanted to ask. So that's fantastic. So I'll just thank you again for your time this evening. I think it's probably far enough into December to be able to wish you a Merry Christmas and a Happy New Year, and you're now free to leave the virtual table, and we'll move us on to the next item.
Okay, thank you. Happy Christmas to you as well.
Thank you. Thank you.
Bye.
So we move on now to agenda item 6, which is the finance update and budget setting. So if I could invite Debbie Mitchell to join us now, and Debbie is the Chief Finance Officer and the Council's Section 151 Officer. So I'm just waiting for Debbie to come to the table, and then we can move on to that item. There we are.
Hi, sorry, I just got kicked out of the call right at the exact moment.
It's always the way, isn't it? No problem at all. So what I wanted to just explain to members before we go into the item as a whole, there's 2 parts to this item. One is the finance update, the other is the budget setting. And there's towards the back of the report, starting on page 19, is a little overview of the budget setting process and how we're going to be doing budget setting this year. In terms of managing the meeting, what I've asked Debbie to do is just give us the presentation update on the first part. We'll then take some questions on the kind of financial position, and there's quite a lot of information contained within Debbie's report this evening. Once we've had a discussion about that and finished on those questions, then I'll ask her just to give us an outline of the general budget setting process, how we're doing budget setting this year, and then if members have any questions about that, then we'll take questions on that section as a sort of second part, a part A and a part B of the agenda. So over to you, Debbie.
Okay, thank you. So in terms of the first part of the report, then it's the Q2 scrutiny. The report went to executive towards the end of last month, and the report outlines the latest financial forecast for the current financial year. And we're facing a quite a significant gross overspend around about 8.5 million. However, there is a lot of work going on to identify mitigation and so on. So we're reasonably, it's considered that we can bring that overspend down to just under 3 million by the end of the financial year. And the report just goes on to outline some of the measures that are being in place to do that mitigation, most notably the cost control boards within social care, and other areas of the council that are looking at efficiencies, vacancy control and that kind of thing. So in the table at paragraph 12, it just shows you the forecast by directorate, and you'll notice that that hasn't really improved since Monitor 1, which is causing some concern. So the position remains serious, and a lot of work is ongoing. The rest of the report outlines the financial impact in each of the directorates and just outlines some of the major variations. So I won't go through that, but I'll just leave it for questions.
Thanks, Debbie. So it's over to members if you have any questions. Councillor Hollier.
Thanks, Chair. I just wanted to ask Debbie if you could say a bit more about the mitigation that's sort of being put in place in adult social care in particular. That'd be okay, thank you.
Yep. So what's currently happening within social care is they're having a weekly cost control meeting where they're looking at a range of things. So as well as looking at where the money is being spent, they're looking at things like high cost packages, identifying support and resources to make sure that we are actively doing reviews for individual customers, and working jointly with health colleagues to make sure that they've got all the appropriate pathways and processes in place to both maximise any central government funding and make sure that the customer is taken and through the right care system.
Thank you, Debbie. Councillor Pearson.
Thanks, Chair. Thanks, Debbie, for the finance report. I just wondered if you might talk a little bit about the Chancellor's spending review and what that might have meant for our long and short term finances.
Yeah. Yes, I have included some text in the report around the spending review, although this report, the deadline for this report was, I think, either the day after or literally the day after the spending review. So it was very early days. I think that there are a number of emergency COVID measures that were included in the spending review. But I think it's fair to say that there is no significant additional funding for local government beyond those emergency measures, which is disappointing, if not surprising, I guess. In terms of some of the key headlines from the spending review, they confirmed that council tax can be increased by up to 2% without a referendum. They also included the option of a 3% precept for adult social care, which was slightly unexpected, actually. So that was something. They announced some additional funding for grant funding for adult social care. The headline figure was 300 million, although only half of that, 150 million, is new money. York tends not to do very well out of national allocations, so our estimates to date are that we'll get less than £1 million from that additional 150 million. The other point to make is that there were a lot of headline announcements of new national money. However, we won't get the detailed allocations or details even of any bidding processes for various pots of money until the local government settlement, which is due next week. MHCLG said that was the week commencing the 14th of December. They didn't say when in that week. So the headline announcements that you might have seen about an increase in spending power is all about council tax, actually. So where they talk about an increase, that is through local taxation. There were some other announcements around the continuation of the Troubled Families Programme for a further year. The Better Care Fund continues for another year. They did also announce a public sector pay freeze, which again was disappointing for those staff that have been working hard over the last few months. There was the continuation of a significant sum of money for things like local roads maintenance and upgrades. And then they also announced a lot of money for support for rough sleepers, support for victims of domestic abuse, but a lot of that was existing money. And the other big thing I think that came out of the spending review was about the national infrastructure strategy and some headline announcements through that. But overall, it doesn't really have that much impact at this stage on the council's financial position, other than the opportunity to increase council tax and the public sector pay freeze. They're the two biggest financial impact on the council.
Thanks, Debbie. I'm just going to jump in with a supplementary of my own there, because we've mentioned the possible option to increase council tax, and obviously, you know, we've had a massive hit to our income as a council. It's partly the increased expenditure, but partly the hit to our income. How likely do you think it is that you know, a council tax rise is going to be an inevitable impact of the pandemic, given the financial situation that we find ourselves in?
Well, clearly that's a decision for members at full council to make. From a financial perspective, given our already low council tax, financially my advice would be not to pass up the opportunity to increase council tax, although clearly it's a very difficult decision that members will need to make, balancing the needs of the community and the financial position of the council.
Thanks, Debbie. Councillor Daubney.
Thank you very much, Chair. Thank you, Debbie, for your report. You spoke a little bit about the issue of adult social care, and clearly we recognise that as being a long-term challenge for local authorities now for many years. In actual fact, you said the government's money might just come down to £1 million for York. Do you think that'll be anywhere near enough towards plugging the gap for the city?
Certainly not in respect of the pressures that we're seeing in adult social care. I mean, really the government needs to come up with a long-term solution for adult social care. They have again deferred or delayed the long-awaited white paper or green paper. I'm not sure what colour we're on now, but they've delayed again that review of social care funding, as they have delayed the fair funding review and the business rates reset as well. So that just adds to our uncertainty and that short-termism. Obviously, it was only a one-year spending review, but certainly we'll continue with this quite short-termism in terms of always a bit on the back foot with adult social care until the government comes up with a national funding solution for social care.
That seems to be the challenge that so few governments want to grasp. It's clearly a very difficult one to cope with, and it's obviously a challenge that some governments sometime will have to rise to. Thank you very much.
Yeah, I mean, just to echo that, I'm sure that most, if not all of us around the table would be happy to do whatever we can to try to support lobbying for more funding and a long-term solution around adult social care. Councillor Rowley, did you have something you wanted to comment on that?
Again, really just to say that I know both of the city's MPs are in the same position of wanting to and are lobbying central government to come up with solutions that meet those needs.
Thank you, Councillor Taylor.
Thank you, Chair. I've got two questions, if I may. First one is, well, it's pretty grim reading. I don't think that'll come as a surprise to anybody. But it's been a grim picture for a while now, before COVID, in my view, due to austerity, and that shouldn't be forgotten about. But I guess my first question is simply, even if we were to have a maximum increase in council tax, savings or, in reality, cuts would still need to be found. And this is something I have to say to residents locally who don't make that connection with how national financing of local government fits into this picture. And on that basis, I'm wondering, will this be the time that City of York uses the headroom that it has in its reserves? Because we do have some headroom. I know we don't really want to touch them, but if you can't touch them after years of austerity and then a global pandemic, I don't really know when we can. And we have some room there. And if that can limit some of the harm that these savings will inevitably cause, then to me it seems an attractive prospect, or at least a necessary one.
Yeah, it's certainly an option. I think the issue is that we have got some headroom in our reserves, but as you'll see from the report, we are forecasting an overspend this year of just under 3 million. Now, if that mitigation isn't delivered, or if we can't get that balanced in this financial year, we will have to use reserves for this financial year. So therefore, it's a possibility. I would at this stage be reluctant to recommend that. I would clearly, again, it's a decision for members to make, but my advice at this point would be to try and not use reserves in next year, because as it currently stands, you will have to use some in this financial year. But I agree that if you can't use your reserves in a global pandemic, then when can you? Absolutely. Yeah, that is what they're there for.
Thank you. And my second question, Chair, is it's more about comms, to be honest, but I'd be interested in Debbie's view on the matter. It's on point 11 in the paper, where it says these actions demonstrate that the council is maintaining both sound financial management and delivering priority services to high standards. Now, I know I'm prone to being negative, but I read that and I think there must come a point when, after so many years of savings or efficiencies or cuts, and then what we've got to deal with now, we can't say that we're delivering things to high standards. And maybe the council will help itself if we move to a place where we start being honest with residents to say, look, we're delivering services to an okay standard or a sufficient standard, but not necessarily to a high standard because of the financial limitations we've been put under. And it also makes me think, are we saying that we can still deliver to high standards, but only on fewer services? And if so, which ones would we be inclined to sort of step away from? Because I don't think you can keep doing both. You can't keep saving and saving and saving and maintaining that standard. Eventually, you stop cutting away at fat and you start getting into muscle tissue and bone. But, you know, is there any scope that the council might be more honest with how they talk about this type of thing in light of the grim situation we find ourselves in?
Yeah, I mean, it's a fair point that you make. I think the point when I write this is that you know, we've always managed to balance our budget every year. My first year as Section 151 may well be the year that we don't. So there you go. So yeah, I take your point. There's the death by 1,000 cuts, isn't there, where you're just slicing off services all the time. But I think that what we have demonstrated is that thanks to our local economy and support from residents and that kind of area, you know, we've got an excellent, robust local economy that has generated sufficient council tax and business rates to enable the council to deliver those priority services, and in our view, to a high standard. I guess it's all relative, and maybe if you determine what you think a high standard is, there's no doubt that as a council, members have got some very difficult decisions ahead of them as a collective, and certainly, you know, there is always a need to make savings. Even without COVID, there is a need to make savings on an annual basis. And you're right, there does come a point where you need to prioritise. And I think through the council plan, that is what we do. The council plan sets out those priorities, and the funding should follow those priorities. So I guess it's you know, for you as members and for the administration to determine what those priorities are. Yes, you've got a point in that. If you can't do everything, if your resources are reducing and diminishing, it's for members with residents to determine what are the priorities.
Thanks, Debbie. I'm not seeing any further hands, so I've got a couple of questions that I wanted to put, but if other members do think of anything else, do feel free to put your hand up. On paragraph 52, you talk about the rent arrears having increased by around 60,000 a month rather than the forecast of 30,000 a month. And I think there's two parts to that, isn't there? There's the kind of the human cost and what that must be doing in terms of perhaps a more difficult financial situation that our tenants are finding themselves in than perhaps we had anticipated. But then also, presumably that has quite an impact from a revenue point of view in terms of you know, the money that's coming into the coffers. I suppose in terms of answering the questions, I mean, you know, there's obviously, I would hope, lots of support going in for the residents, and you know, I know that you know, we do sort of proactively look at things like, you know, council tax arrears and you know, where we can do assistance. I guess from a finance point of view, I'm just wondering if you have a sense of, you know, we were forecasting 30,000, but actually it's looking more like 60,000. Is that graph going upwards, and are we sort of expecting that level of arrears to increase month on month, or is it just that we've had a bit of a financial shock and actually we think it might stay relatively level, or perhaps start to curve off again? What have you got a sense of where those rent arrears are going at the moment, in what direction?
I haven't actually, but if Patrick is on the call, Patrick might be able to assist there. He might not be on the call at this moment in time. No, I'd have to come back to you on that. I haven't got the details on the HRA rent arrears. Okay,
well, we'll pick it back up with Patrick, either in this meeting or outside of this meeting, because I think that would be something that I'd be interested to know a bit more about. A couple of other things that jumped out to me from the report. One was paragraph 35. And the DSG, which I think is the Dedicated Schools Grant, is that the get all me and acronyms correct?
Yeah.
And there's a deficit there of 4.8 million, nearly 4.9 million. But what really shocked me was that this expenditure indicates that the deficit could grow to 10 million by the end of this financial year. And I wondered if you could just give us any sense of you know, what's driving that, what's being done to look at that, and I mean, I don't know if mitigate is necessarily the right word, because my sense is this is probably quite vulnerable people who need a lot of support, so you don't necessarily want to not deliver that support, but what's the impact to the rest of the directorate if you're suddenly looking at that size of a deficit, which is bigger than anything else I think I've seen anywhere else?
Yeah, I mean, the 10 million is a worst case scenario, hopefully. So as always, we continue to plan for the worst and hope for the best. But the reason that we included it is just to make people aware that there is extensive pressure, particularly in SEND and those high needs numbers. Now, government is aware of that. That's a national issue. It's not unique to York. However, the DfE will expect us to do a recovery plan over the next 3 years. So as it highlights in the report, there is national lobbying going on for the SEND review to move forward, because these, again, it's a bit like the social care issue. It's a national funding issue that until the government can step in and resolve that funding issue, we'll continue to experience these challenges just because of the increase in numbers of those high need individuals.
Thank you. And committee members, I had wondered whether that might be something that we might want to ask the Children Education and Community Scrutiny Committee to just look at in a little bit more detail. So if members are in agreement that we make that recommendation to them, if you could perhaps just give me a wave of a hand to say that you think that that's something worthwhile. Yeah, I'm seeing plenty of hands. Great. So Dawn, if you could just make a note of that, and we'll ask that committee just to look in a little bit more detail of that. The other question that I had, which has sort of partially been touched on already, but I wondered whether you can elaborate at all on it. And again, I'm half a mind to think that this might be something that Health Scrutiny might want to look at a little bit more detail. Paragraph 48. So there's a whole section on the health and adult social care where there's a lot of overspends, and I sort of gave up trying to tot up all of the overspends because it started to get quite scary, which I'm sure must be your day to day at the moment. But the last paragraph talks about mitigation work, and in particular made reference to some peer review work, which I thought was interesting and really encouraging to see that we're doing. And then there's a report that's due to come back, I think, in January, a peer review report. I wondered, if you could give us a little bit of information about that, if you know it, and also, again, for committee members just to be thinking, I had wondered whether that report might be something that we might ask the Health Committee to take a look at as and when it's published or is appropriate to do, because it seemed to me that could be quite an important piece of work that's ongoing.
Yeah, it's at a very early stage, and I don't have a lot of information on it beyond what's in the report. Actually, Amanda Hatton, the corporate director of People, will be. I think they're just scoping out what they want doing and organising the peer review team now. So that work will be ongoing, due to report back, I think, later on in January. But I can certainly, I'm sure Amanda would be happy to tell you a bit more about that at a future meeting. So I can take that away.
Thanks, Debbie. Well, again, if I just ask the committee, I mean, my sense would be that might be something. I know that Health have a forum meeting in January, and so depending on the timing, if the timing works, that might be perhaps something that we could ask them to ask Amanda to give a bit more detail on, and if there is any detail of the report, perhaps to give them an early sight of that. So again, if committee members are happy that we add that as a potential item for the work plan, if you can give us a little wave of a hand. Just looking for others. Yeah, fantastic. Dawn, are you putting your hand up just to make a comment if you want to?
Yes, Chair, I just wanted to come just as a little health warning, pardon the pun.
Yeah.
I think the health forum meeting is quite early in January, so we'll be looking at, obviously we tried to indicate that we'd distribute some papers in roughly the same timescales as we would for a public meeting. So I suspect the time is not going to work for that one, is what I'm saying. We'll look at it by all means, but I suspect it's going to be too early by the sound of it, because the papers are going to go out roughly that week between Christmas and New Year, I suspect. Because I think the forum is actually about the 8th, because I looked at it earlier today. So yeah, but
so I think what we'll do then is if we log it as something that we'd like the forum or that committee to have a look at, and we'll have to speak with Amanda Hatton about the timing of when the report's due back, what information she has already. We'll have a look at when the forum meetings is and what the publication dates are, and work out where it's most appropriate to sit. But I think if we ask that committee to have a look at that report as and when it's ready, because it does seem to me that could be quite a key and important report coming forward. Councillor Fenton.
Thanks, Chair. Yes, yeah. Just to add to that, I think where we in these reports get mention of areas of work where we think scrutiny can add value. I think where we're not clear what the report is, what it covers, and what the timescale is, it'd be useful to either for you as chair and myself, or the chair of health and adult social care, to have a conversation with Amanda to try and get a better idea as to exactly what it is. I wouldn't want us to commit to something in this meeting that wouldn't be deliverable, or wouldn't be it wouldn't be the appropriate time to discuss something that's still in a formative stage. So I think it'd be helpful to have that discussion. But I agree, as an area that I would imagine that scrutiny would want to be involved in. I've no problem with that. Just quickly coming back to the rent arrears point. I know at paragraph 52 it mentions the financial support is being provided, and I think, and Patrick Lucker might confirm later, that I think an initial £80,000 has been committed to help with arrears for CYC tenants, with the potential for more to come if that's needed. So I'm sure Patrick will confirm, maybe offline, but I think that's the current status in regard to that.
Yeah, I can just add to that, actually, because Patrick's been able to just send me some information while we've been on, and that whilst current levels are higher than last year and they were increasing, they have started to fall from October. So we're hopeful that the arrears picture is improving.
That's really helpful. Thanks, Debbie. And yeah, I absolutely take your point, Councillor Fenton, and agree. I don't want to sort of bind another committee to looking at something. I think what I'm suggesting is that we flag it as being something that they want to perhaps investigate and see whether it's worth them then taking it on as part of their work plan. Councillor Taylor.
Thanks, Chair. I mean, my question's on the budget setting part of this discussion. I don't know if it's premature to do that now, or
I was looking at the number of blue hands up, and there weren't any till you put your hand up, and so I was going to suggest that we move us on to the budget setting part of the meeting, unless anybody had any further questions on the finances, as it were. And in which case, I think probably, if it's all right, Councillor Taylor, what would be helpful would be just to invite Debbie to talk to that part of the report, and then I'll give you first dibs on questions.
Yeah, cheers.
Yeah, okay, so I've just included a really brief section, and I've based it on what would happen in a normal year. So what we would ordinarily be doing. So, and whilst the timing this year might have been slightly different, actually the process is broadly the same. So just as a reminder, we have to have a balanced budget for the forthcoming year, as well as a medium-term financial strategy which looks over the next 3 years. And generally within the public sector, because of increased demand and inflation, our projected expenditure is nearly always higher than our projected income, which leaves us a budget gap. And that's where we start looking for savings. So we've got to make every effort to make sure that that budget gap is closed. There is a significant amount of legislation around local authority planning and budgeting as well. And I've just quoted some of the legislation in there in terms of certainly my personal responsibility as a Section 151 officer to make sure that the budget is robust and that there are adequate financial reserves. And again, that I am required by legislation to consider a Section 114 notice if I think that there is likely to be unlawful expenditure or an inability to balance the budget. I'm not in that position yet, so we won't dwell too much on that. So what would ordinarily happen is I've split it down into parts of the year because that's the easiest way for me, I think, for me to explain what happens. So in April to July, we would spend some time looking at our revenue, income and expenditure over the next 3 years. We would update it for the previous year's outturn. So any areas that had overspent or underspent, we would take account of those. To come up with that medium-term financial strategy, we would start to look at that. And that would include us doing things like forecasting from an officer perspective, modelling what council tax increases might look like, what the position would be with and without those, what reserves are looking like, whether we could release any reserves that were no longer required, and also looking ahead and speaking to services around what pressures were coming up, what perhaps new legislation that required us to do things differently. So all those kind of things that you would expect in forecasting ahead. And then from July to September, we would carry on with that work, really, looking at any new budget pressures. We would calculate that forecast budget gap, and we would set chief officers and heads of service on with detailed work, really, to identify any new efficiencies or possible savings proposals that we could put to members. We would also start looking at the capital programme. As you know, we've got a 5-year capital programme, although we only, we look mainly at the next year or two, but we would again consider any capital projects that might be needed. And we would start to have discussions with executive members around a high-level summary of the medium-term financial strategy, outlining for them the scale of any savings that were needed. And then the bit that we're in now, October to December, which is what we've been doing, we've been finalising those officer proposals with the executive members, with the portfolio holders, taking them through the potential impacts and risks of those proposals. And what we'll be doing next week, hopefully, when we get the provisional settlement, is then we'll have another review of the overarching budget for next year in light of any spending review announcements, and we'll update our budget assumptions for those announcements. So should the government come along with a load more income for us next year and a nice big grant that they're guaranteeing us for the next 10 years, then obviously we would factor all that in. So that we're ready then in January for executive member decision sessions, which will publish the budget proposal. So each portfolio holder, each executive member will have a decision session. In some areas where they're the smaller portfolios, they'll have a joint decision session, and we'll include within that report setting out the context, the current issues in the budget, and the proposals that are relevant to that portfolio. And they will then be published. I think the first one is published on the 4th of January next year, for all those sessions to go ahead and have discussions. That will be part of that'll allow for wider discussion with residents, other stakeholders, and clearly opposition members as well. And then in February, the revenue and capital budgets will be considered first of all at executive and then debated at full council, and the council tax will be set. And then obviously once the year starts, actual spending and income will be monitored against those budgets, with the regular reports highlighted to executive and to scrutiny committees outlining any variations. We track the savings as to whether they're achieved or not. If they're not achieved, we would identify alternatives so that we still had a balanced budget. And the thing that runs throughout this actually is consideration of the equalities impact. So again, as you'll know, we need to do an equalities impact assessment of these proposals. And what we do as we go through and develop these potential savings areas is we do a high-level screening sheet of the potential equalities impact, so that members have got that information as they're discussing the savings. And we'll include some of that in the January decision sessions. And then, like I say, we monitor the budget as we go through the year. We do the outturn. We see what happens. We'll manage the budget as we go along. Where there are overspends, we'll identify mitigation, as we've just been talking about in the first part of this report. And then we get back on the hamster's wheel, if you like, and we start again for the new financial year, and we update that 3-year strategy as we go along for any major government announcements. I'll leave it there.
Thanks, Debbie. That's really helpful. So, Councillor Taylor, I think you had a question that you wanted to put, and then anybody else, if you want to be sticking your hands up.
Thanks, Chair, and thank you, Debbie, for that summary. I just wanted to talk about the typical timeline that you've laid out. I accept it's a sort of this is what we normally do type thing. But I'm wondering where one of the motions fits into this that was approved, well, after being amended, was approved at last full council, because one of the resolves in that committed the council to give all city councillors headline budget savings targets and draft savings proposals by mid-December this year. As I say, I accept that this is a typical timeline, doesn't necessarily mean it's exactly what this one's going to be like for us. But I guess I'm asking or hoping that resolves will be honoured in this timeline for us as members. Are you able to comment on that at all?
I'm not. I'd have to go back and have a look at the motion actually, because I can't immediately recall what was discussed around that. But certainly, well, we're nearly at mid-December, aren't we? But they'll certainly be with you for the first week in January.
Councillor Taylor. Yeah.
Thank you. I mean, sure, you know, if you need to go back and refer to it, then that's what you've got to do. But if it's of any reassurance, it's one of the parts of the motion that the ruling parties didn't decide to amend or tamper with, so it does have seemingly unanimous support, and I'd be really quite concerned if it wasn't honoured, at least honoured to the best of the council's ability by mid-December.
Okay, I'll take that away. Like I say, we're expecting the spending review next week, and we would normally want to see the detail of the local government, not the spending review, sorry, the local government settlement next week. But yeah, I'll take that away.
Thanks, thanks, Debbie. And perhaps if I could ask either Dawn or Janie just to make sure that Debbie's got the appropriate parts of the resolve on that, because I think Councillor Taylor's right. It was quite a clear and explicit resolve from last month's council meeting.
Yeah.
Councillor Fenton.
I suppose just following on from that, what's been the impact of the later than usual spending review settlement? And you mentioned the fact we haven't yet received our the local government settlement. So what impact has that had on your ability to sort of further develop the plans that are being worked on?
Yeah, thank you. We wouldn't normally get the settlement until this time in December. So it is usual that we would have a spending review and then a settlement. The difficulty for us has been in a normal year, you would have a reasonably good go at estimating council tax and business rates because you've got that history. So you know what premises you've got in the city, you know how many residents you've got, you know what type of property you've got, you know what new houses are nearly going to be are being built and nearly finished. So you can do a much better estimate. I think the difficulty that we've got this year is that trying to estimate what we might get in council tax and business rates next year is a real challenge. So as I think we've discussed at this committee before, my concern has always been around what happens when the furloughing scheme ends. And so every time I've got a bit nervous about that, they've extended the furlough scheme, which must be really difficult for those people that are on furlough, let alone for anybody trying to forecast a budget. So it's the uncertainty that is proving difficult for us, because like I say, normally you can forecast these things with a reasonable amount of certainty, and they're always only estimates. I mean, the whole budget, I would again make the point, is it's a plan. It's not definitely what's going to happen. It's a plan in financial terms, and so it is only ever just an estimate, and things will always happen. But you can have a reasonably good estimate, and that's what's been the real challenge. And then some of the things that we'd flagged as risks last year, such as the fair funding review and the business rates reset, the uncertainty around those, that uncertainty continues because the government has delayed that, but we don't know when till. So if they were going to reset business rates, we don't know whether that would be good or bad for us actually. And also the fair funding review, we are traditionally a low funded council, as again, as you're all aware, we've got a low council tax. We tend not to do well out of national allocations of funding. So again, we don't know from the fair funding review whether we would do well out of that or whether we would do badly. So that uncertainty has made it really difficult for us to forecast. Add to that the way that the government has, understandably in some areas, dealt with the pandemic and not understandably in others. So some of the I think I've used the phrase before, the drip feed of government funding announcements in relation to COVID. So if you think that we've had 4 tranches of the COVID general support grant with potentially a 5th to come. I mean, they did announce in the spending review another 1.55 billion for local government for COVID. So we have a bit, and then we have another bit, and then we have another bit. And that makes it really difficult to make proper decisions, because, you know, had we known at the beginning how much money we were going to get, I think it would have been more, you know, it would have been better for us as an organisation to have a clear understanding of what the funding was, rather than the position we had, which was being told to spend whatever you need, the government will cover it, to then, you know, rowing back from that position to these little grants. And then they've also issued a number of grants that are ring fenced, and so there's the Container Outbreak Management Fund, there was the Infection Control Fund, and I think again it was at this committee that the last report I brought, where I did a full list of all the grants, and it was quite a long table of different grants, and I think we've probably had another half dozen since then. So that short-term approach makes it really difficult to plan on the longer term, and so there's a temptation, I think, to wait for certainty, but we're not able to do that. We've got to get on and plan a budget and do that, like I say, prepare for the worst and hope for the best, which never feels like a very satisfactory way to carry on.
Thanks, Debbie. I'm not seeing any further hands on this, so I think what I will just do is just briefly give people the dates of the budget decision sessions that are penciled in. As far as I'm aware, these are now firm dates, so they're mostly on Tuesday the 12th of January. So we've got transport, environment and climate change and economy and strategic planning, then housing, then later in the day the leader and the finance and performance exec member. And then on the Wednesday the 13th is health, and then children. Well, it says here on my list children's and culture. I assume that's children's education and culture and communities and that directorate. But broadly speaking, Tuesday and Wednesday the 12th and 13th of January are the key dates. And as you said, Debbie, I think the publication of those reports will be the 4th of January, which is actually the date of our next CSMC meeting. So it'll be a busy January for everybody. But thank you very much, Debbie, for your time this evening. I think that's been really helpful. And I think we're not anticipating seeing you next month because I think you'll be so tied up with everything budget-wise. But there's plenty of opportunities for members to find out what's going on and put questions to you, I think, within the meetings already planned. Yeah. So you're now free to leave. But again, thanks very much, and again, happy Christmas and a happy New Year if we don't see you.
Thank you. I should probably hang on for the stadium report, so I'll stick around in the background.
Oh, are you going to be around? Oh well, fantastic. In which case, I'm premature with my season's greetings. Right. But what I'm going to do now is move us on to the next agenda item, which is agenda item 7, which is our work plan. I'm just going to briefly go through this. You've got some information in your report pack, and I can just update you a little bit further. So tomorrow we've got climate change scrutiny, who'll be looking at the climate change strategy, the York emissions reporting, and also the York Climate Change Commission. Later in the week, we've got housing and community safety, who will be looking at winter provision, accommodating rough sleepers post-lockdown, and the environmental retrofitting policy as a piece of policy development work. We have had a call-in, so we're anticipating that this committee will be looking at a call-in on the 21st of December. That was the provisional date, but we're just looking to firm that up and finalise times and what have you. So I will be in touch as soon as I possibly can, just to give you the firm details of that. The Economy in Place forum that was due to take place on the 23rd of December, we have pushed back into January, just to try and keep that Christmas week clear as far as we possibly can. And then moving us into January, our own committee, the CSMC, is meeting on the 4th of January. And what we're proposing is we will take the usual COVID update as we have done this evening, but we'll forgo the finance update given that there'll be so much finance work going on in January anyway. And so the principal item will be the request around York Central. You'll recall we have a quarterly standing update on York Central, and at the last quarterly update, Neil Ferris, as the corporate director, had reiterated a request that I think this committee had made earlier in the year to look at the governance structures between the different partners and how the terms of reference of the various different boards within the York Central Partnership relate to each other and refer to each other. So we're hoping to have both representatives of the council, but also all of the partners as far as we can coming to that meeting on the 4th of January. The next day is Children, Education and Communities, and we're just finalising what that agenda will look like. We've got a meeting on Monday with the chair of that committee. And then moving into January, we've got a forum meeting of the Health and Adult Social Care on the 12th of January. And we've discussed potentially looking at that peer review, although obviously we'll need to just check on timings and what's appropriate there. And moving to the back end of January, there's a couple of slots. There's a commission slot on the 18th of January and a potential call-in slot on the 25th of January, and then also another potential commission slot on the 1st of February. And I think what we're looking at is trying not to overload democratic services, because that's potentially 3 meetings in very quick succession without necessarily wanting to kind of use slots for the sake of using slots. But there are some ideas floating around, possibly around doing some joint scrutiny work between a couple of committees and 1 or 2 other things. So what I'm hoping to do is be able to update you a little bit more on the 4th of January as to what, if any, of those slots will be used at the back end of January, beginning of February. And then into February, again, haven't really formalised anything around the agenda for this committee, but things that are floating in the background are the annual complaints reports, which went through audit and governance earlier this month, which would normally come to this committee. And also you'll recall that we had Trudy Forster talking to us about the day 1 absence management, and that will be coming up for a reprocurement. So we're just going to double check the timing, but potentially February for that, although that may slip to a little bit later in the year, depending on how the timing works on that. So unless anybody had any questions or anything that they particularly wanted to raise, I'm just proposing that that's all there to note. No, not seeing anything, so I will move us on from that to agenda item 8, which is urgent business. We haven't got any urgent business, and so what I'm going to do is propose that we move to an adjournment in a few minutes, in a minute or two's time. Just before we do, I just want to raise a concern that's been raised with me, and it's a concern that I already had, and it's part of the reason for this slightly longer than normal adjournment, which is that this committee didn't receive all of the papers for this evening's meeting until this afternoon. And it's a bit frustrating because we were asked as a committee to do a piece of pre-decision work on the next item back in mid-November, so with quite considerable amount of notice. And I was certainly under the impression that what we would be having was early advance information on the report that was coming to executive, with a view to doing some pre-decision scrutiny to try and act in our role as critical friend, looking at whatever we can do to improve public services, and to be a constructive voice within this. I still think that we're completely able to do that. I've had a really constructive conversation with Patrick Looker this afternoon, who will be giving us a presentation setting out all of the information in the reports. But I do think if we're going to be able to do our job properly, members do need time to be able to read, digest, consider and think about what questions they want to know and how they want to go through things that are being brought to us. So it's just wanted to make that point publicly, that I really don't think it's okay for us to be given information right at the last minute to then make some kind of a meaningful decision on going forward. But with that in mind, I will want us to engage constructively on the next section. Councillor Taylor, I can see your hand up. I'll bring you in 1 second, and then I can see a message on the chat, and I am proposing that we will go to an adjournment in a couple of minutes' time, and I'm proposing that that will be an extended adjournment because I want members who haven't had time to read through the papers to have an extra 15 minutes to be able to read through the papers before we move on to addressing that item. Councillor Taylor.
Thanks, Chair. As ever, you put it a million times more diplomatically than I ever could. I just want to put on record that I think it's an absolute disgrace that these were sent out less than 5 hours before the meeting starts. One of the papers was actually signed off on the 4th. You know, so we could have had the weekend to have sight of at least some of the materials that have been sent out. It's not good enough. I've been working today until 5, and also you need time to digest the information you're given. I appreciate the extra adjournment and the time that we're getting now, but it's far from ideal. It's absolutely it's bang out of order in my view, and it treats us with contempt, especially those working in the daytime.
Okay, I think we've made the points on that. So what I'd like to do now is propose that we take a 15-minute adjournment. So I make it 7:05. I propose that we come back at 7:20, and then what I will be doing is seeking to guillotine the meeting at 8 o'clock. So if I can have you back promptly at 7:20, and I hope that that gives people enough time to at least have an overview of the report. And as I say, we have Patrick Looker, who's the finance officer, who will be giving us a presentation which will summarise the report as well. So if you'd like to switch off your video feeds and follow the messages that you receive, and see you back promptly at 7:20. Right, good evening and welcome back to today's meeting of the Customer and Corporate Services and Scrutiny Management Committee. We're about to move on to agenda item 9, which is the new stadium leisure complex commercial proposal on restaurant units, or perhaps community stadium update might be the quicker and simpler way of referring to it. Just before we move on to that item, I said I would just refer us back to our agenda item 2, which was the exclusion of press and public. Can I just ask if members think that they are likely to want to ask any questions relating to the confidential papers? If you could just give me a wave now if you think you might wish to. I'm not seeing anybody that's wanting to. So what I propose that we do is we'll just proceed as normal. If members do find that they're wanting to ask a question, please don't ask it out loud, but please just indicate to me that that's what you're wanting to do. And if members do find that they want to ask a question relating to the confidential papers, then we'll just have to move a proposal to take us into a private session. And I'd like us to try to hold that right to the end of this next section if we can do. Just so that we have as much of this discussion in public as we can. So I'll move us on then formally onto agenda item 9 and invite the various officers and the executive member to join us. So we should be being joined on screen by Patrick Looker, who's the finance manager. I believe we have Paul Forrest as the Community Stadium Project Officer available, and Nick Collins as the Head of Asset Management. And I see also Councillor Nigel Eyre has joined us as the Executive Member for Finance and Performance. So I think, Patrick, you had a presentation that you're going to deliver to the committee just to take us through the report, and then I'll invite perhaps Councillor Eyre if you wanted to add anything after that point, and then I'll invite members to ask questions once we've done that. So over to you, Patrick.
Thank you, Chair. I'll try and share my screen, so let me know if you can see that.
Yeah, that's visible to us all.
Okay, so what I'd like to do is just briefly go through the key parts of the paper that has been circulated to you. There was the paper that came through in the original agenda, which set out the key issues around where we got to on the deal. And this presentation will also look at some of the financial analysis of the options that members have got at this point in time. So, looking at the background of the report. In September 2014, Cabinet confirmed GLL was a preferred bidder from the stadium procurement exercise. The first I can come across the stadium was, I think, in 2009 when Council approved going forward on that. So as you'll all be aware that this has been a long-standing commitment from the Council. In March 2016, Executive agreed to the GLL bid and the funding towards the stadium. That assumed £12 million would be coming through a commercial funding towards the project. So from that point on, we've always been working on getting some of the funding from the commercial land deal. In July 2017, Executive were noted of a lower commercial land deal, but also a slightly cheaper capital cost, and members agreed to progress the scheme to financial close. And in order to get to financial close, Executive needed to accept a risk that the commercial land deal could be subject to a reduced value should not all of the restaurants that were part of this deal be let. And that is where we are now. So in October 2017, the Council agreed to proceed to financial close. And at that time, informed that the commercial land value for the sale of these restaurants would be effectively 3.825 million, but it would be reduced by 0.6875 million if only one restaurant unit was let at that point in time, and reduced by 1.375 million if no units were let. And that is the current position where we are. None of the restaurant units within the stadium east stand have been let at this point in time. We're about to move to service availability in the next few weeks, so effectively we've got to make a decision on where we are. So there's three options in the paper that the Council is at. Option one is kind of the default position that was accepted back in October 2017. and we will receive a reduced capital receipt because none of the units have been let. But the developer has come up with two options back to us. Firstly, that option 2 is that the council can let the units from the fund at commercial rent, and we will then receive the full capital receipt that we were expecting. And a final option where we could take ownership of the 3 units, we would forego £3.8 million receipt. We'd also forego £600,000 contribution towards the building costs of the units. So if I look at all those 3 in turn, option 1, a loss of 1.375 million will mean that we require additional borrowing of that amount. That will cost us £96,000 per annum. The developer will also give us a contribution of £70,000 almost on the basis of because they haven't been able to let those units, it's a contribution from them. Option 2, we receive the full commercial receipt, so we don't need to undertake any further prudential borrowing, and we will let the units at a commercial rent. There is an opportunity to sublet, but that brings on additional risks to us. So there's quite significant costs when the units are void, pick up service charges and business rates. And we also require approval of the pension fund if subletting at a lower rent than what we are paying. In option 3, there would be a loss of 4.4 million, which I discussed earlier, the 3.8 commercial receipt and the capital contribution to the building costs of the units. So we would have to prudentially borrow that 4.4 million, which has annual borrowing costs of £308,000. We would be free to sublet units. We wouldn't have the restriction where we'd need permission if we were doing it at a rent lower than what we were paying, but we would continue to be responsible for void periods. Confidential Annex 2 that you've received gives you all the assumptions in the financial details of the terms, the rental levels, the sublet rentals that we're assuming, the levels of rent-free period that we've modelled, the void periods, the early years cost pressures, and also the external valuation that we've had on the 3 units. And this is effectively what's in Annex 1. This is the modelled number of scenarios that we've done. The black line represents the borrowing that we would undertake if we were to walk away and not accept the 1.375 million. It's a fixed line, we can be certain of those. The 3 dotted lines, the green, red and blue, are the option 2, where we sublet the units and pay commercial rent to the fund. The red line is what we think is the most likely, but as you'll expect in 25 years, it's difficult to predict what will happen over the next 25 years. The green dotted line is a worst case scenario where there'll be additional voids and it'll take longer to let and the rents won't be so high. The blue line is one where we are assuming that in a few years' time, year 5, I believe, that rent levels will get back to where they were pre-pandemic, back to 2017 kind of levels, and therefore we potentially will be in a similar position to borrowing. But that blue line does assume that things will work in our favour on that regard. And the green line is option 3, which is taking ownership of the units. I think the only thing that I would say on that option 3 is that we would then become only units after 25 years and we wouldn't have to hand them back. So there would potentially be an asset there at the end. In terms of the conclusions, what we're recommending through to executive, we're recommending option 1. It's the only option with certainty. The other 2 options do have higher risk due to the current economic climate. And yeah, I think that's probably as far as I'll go with that presentation. So happy to take any questions that members may have.
Thanks for that, Patrick. I did say I would just invite Councillor Eyre to add any comments that he may wish to that presentation. So Nigel, I don't know if you wanted to add anything further, and then I see Councillor Rowley waiting with a hand up. So.
I'll be brief. I think I just wanted to go through something of the why and the what in terms of where we are today. So it goes back a bit before Patrick suggested. So it's 2003 when the football club found themselves technically without a home, having lost ownership of their ground. It was at that point the council stepped in and said they would work with the football club to try and ensure their survival. Due to the council's involvement, that led obviously to a commitment to deliver a community facility rather than purely a stadium, and led to the partnership working with organisations such as the NHS and the universities. The initial funding available was £2 million from the Football Stadium Improvement Fund. Clearly, that's nowhere near the amount it takes to build any sort of stadium, let alone the stadium we want. That capital shortfall was always significant, and the original way of working around that was the Vanguard Enabling Development that was agreed in March 2012. That upped the budget from around £2 million to a £19.2 million costed stadium, and actually reached a point where we were at a situation where we could go out and commission a stadium. Through that procurement process, which launched in 2012, we then got to 2014 when the decision was taken to include the running of the leisure facilities across the city and the replacement of Waterworld as part of that. That decision in 2014 effectively doubled the capital cost of the stadium from £19.2 million to £37 million. And as Patrick alluded to, the key component of funding that increase was the £2 million land sale deal that he has mentioned. At that point, in many ways, the project became beholden to that land deal. The land deal had to be concluded before we could move forward on the stadium, with it effectively funding a third of the entire capital costs. It took significant time to be able to secure that funding. When we finally got towards the end of that process, as Patrick said, around about October 2017, the assumed £12 million was not available, and the closest we could get was nearer 10.7. We were able to bridge the gap in other ways around that period, but as was mentioned, the pension fund at the very last minute were looking at a potential £1.3 million reduction in the capital receipts to the council. The council did have an option at that point. I wasn't on the executive at that particular time, to either take the upfront borrowing at that time and incur the cost then, or to work through the deal that we've got forward today, which was to attempt to get those units let in order to maintain the higher level of the capital receipt. That is a very, very nutshell history of where we are with Community Stadium. If anyone ever gets bored, I'm willing to take them through weeks and weeks of information about going back to around about 2002 when I first became involved. But what I sort of wanted to finish in around, if I'll come back to some of Councillor Taylor's comments, is actually what is coming out of this, because I think we too often forget the positives around this. We will have an 8,000 plus seater stadium in the city, by far the greatest stadium of its type in probably the next 1, 2, 3, 4 divisions. We're delivering a community hub. We've secured that sort of unique partnership with the NHS, which will deliver absolutely first-class outpatient facilities. We have a regionally significant venue. The stadium has been single-handedly important in terms of the work the Knights are doing in trying to attract Super League to the city. That simply wouldn't have been possible without this stadium. And obviously, we've got the Rugby World Cup coming to the stadium as well. We do have the new leisure offer. We do have reduced revenue costs, and we're able to work with other partners, such as York Against Cancer. The purpose of this paper is, I think Patrick and Debbie, if she's still here, would always take a purely commercial and financial view and say that option one is by far the safest and most financially secure of those options. What we wanted to do is get as much input as possible from Scrutiny to see, as a local authority, and as I've had those conversations frequently, I think recently with Councillor Crawshaw and Councillor Kilbane especially, that we're not here as purely financial bodies. We do have to look at the wider social value of everything that we do, and to examine whether anywhere through these options there is the opportunity for us to potentially forego a certain amount of financial return in terms of securing a wider social benefit to the city and the particular area. And just adding on to some from Councillor Taylor, yes, there's a huge amount of work gone on behind the scenes. The paper wasn't signed off. The figures were not there until the 4th of December. In fact, I continued to talk with Nick Collins on the 5th and 6th, I think, as we continue to potentially revise what those may be in terms of an ever-shifting financial situation, which obviously would need to be discussed in private. I had thought that those papers were going to go out on Friday, and I take your point on that one. That's my understanding. But one of the things around this is that it's ensured that the entire committee has had access to those confidential papers. If you go back in time, for example, to the 2014 decision, when we became initially locked into this commercial land deal, no opposition members were given sight of those confidential annexes that attached that to that decision. It was only through the call-in process were we able to get an even sight of the business case and how that commercial land deal had been done. And even at that point, as a call-in member, I was not allowed to see any of the confidential annexes because the monitoring officer said I was not on the committee. As a calling member, I was not entitled to sit. The previous monitoring officer advised that not as a member of the committee, as purely a calling member, I was not able to see the confidential annexes. So we have tried in a very difficult landscape to be as open and transparent as possible. And I appreciate the difficulties of it. But as I say, those figures have been changing on a rolling hourly basis in terms of the work that we've been doing. With that, happy to answer any questions, Chair.
Thanks, Councillor. Councillor Rowley.
Thanks, Chair, and thank you, Patrick and Councillor, for your comments. I mean, clearly, looking at the options that are there, it would. Sorry, forgive me. Are you able to hear what I said? I was just saying, clearly, the options that are on the table for you, to me, the only viable option is option one. However, that is going to cost the council £1.374 million, not a small sum of money. You did allude a moment ago, Councillor, to the fact that these units could possibly be used for activities other than the restaurants. I'm just thinking, obviously, post-COVID, and with the potential funding that may come through the post-COVID programme, and the community groups that are going to be around in the city, is there any scope to allow those units to be used by community groups in terms of aiding and assisting with the post-COVID in the city?
Want me to come back on that, Chair? That's one of the reasons why we brought this back to scrutiny, Councillor Rowley. I think the reality is, under option 2, if you go through the subletting route, that is as restaurant units. And as Patrick alluded to, there is a sort of a restrictive covenant that the pension fund has on that, who would have the final sign-off on any use of that. So that would be very unlikely they would sign off on any use other than restaurants. If you take option 3, which is to take the units outright, then yes, that does give you the opportunity to use the units for whatever you want, as it were. The question then comes around to is the price right in terms of what you're paying for that flexibility, or are there better ways of using that money?
Just, Councillor Rowley, I'll bring you in for a supplementary. I just wanted to clarify, because my understanding was not so much about there being a covenant on the type of use, and it was perhaps more to do with not being able to undercut the developer for the rental income that they may get from some of the other units that they may be using.
It's a little bit of both, and I'm walking a tightrope because I'm not sure what we are or aren't allowed to say. Yeah. But yes, there is. They would have an interest, as they have units themselves, that they are still trying to let at this process. So they would have an interest in, if we were to sublet at a lower price, that would obviously have an impact on their ability to let their own units. So they may take a view of that underletting. But equally, a lot of the legal agreements we saw at the start would give them, in many ways, a final veto on pretty much any use of that building.
Councillor Rowley, did you have a supplementary on that?
Yeah, thank you, Chair, and thank you for that answer. I guess I just want some clarity then around these options. So the units that are there, if we went down the option 1 route, do we then forego any opportunity to utilize those units? So we're basically saying that those units then belong to the developer. They can do with it what they want. They effectively take the risk, but we lose potentially £1.375 million because they're not in our ownership to lease. Is that what we're trying to say?
That's absolutely right, Councillor Rowley. The intention always was that they would have let the units, and they would have paid us the full receipt, and they would be effectively all trading as probably restaurant units, which we would have no particular input into that. But that was the commercial deal that we originally set up for, that the developer, the fund, would have those units.
In many ways, Councillor Rowley, it's in a way of saying that they agreed to purchase the long lease, on that 250-year lease for, I think it was 3.8 million, did you say, Patrick?
Yeah.
they were willing to pay that amount for it if the units were let. If the units were not let, they only wanted to pay £1.7 million. So in effect, it's defaulting down to the lower price.
Councillor Rowley, did you want to come back?
Yes, and this is my final supplementary, Chair. Thank you so much. So again, just for clarity, are we saying that if we go to option 1, we will lose the 1 point, forgive me, I haven't got the figures in front of me again, £1.3 million pounds. Yeah, so if we lose that's a hit that we have to take. There's no way of offsetting that in any way, shape or form.
That was the deal that was signed up to effectively by executive in October 2017. So that is current. That is kind of the default deal.
And that's where option 2 comes in, Councillor Rowley, is that if we effectively let the units ourselves, they are technically let at the point of completion, at which point we become entitled to the extra £1.35 million. So we take the capital. However, we then have the risk that we have a 25-year lease on 3 restaurant units, and our ability to, we will then be paying them their guaranteed rent for the next 25 years. And it's up to us then whether we think we can get back the amount of funding that we've invested in that. At the moment, the officer's modelling shows that that's probably not the case.
Thank you. I'm just going to, I've got Councillor Fenton and Councillor Pearson. I see your hands and I will bring you in, but I think because it's on the same subject, I'm just going to abuse my position as chair just to ask a sort of a partially supplementary question on that. Because it did occur to me that the developer would have a financial interest in not letting those 3 units once we got to a certain distance away from the completion. So once you're sort of 6 months away or possibly even a year away, the amount of revenue that you would generate from letting those 3 units would potentially be less than the 1.4 million that you would save by not having to pay that capital cost to the council. So I just wondered if you could give us any indication of, I suppose, A, when it became clear that those 3 units were not going to be let, and B, what's been done to ensure that the developer has acted reasonably in terms of actually trying to let those units and not just taken a commercial decision to say, well, actually, we'll save ourselves the 1.4 million, thank you very much, and in a couple of weeks' time, when this is all done and dusted, we'll be letting them out and taking the revenue from that.
Thanks, Chair. There's 2 points there. First of all, in legal terms, they had to use their reasonable endeavours to ensure that they were let. So there was a contractual requirement for them to do that. There was also a financial penalty on Rembridge, who are the developers, not the fund, who are compensating us for £70,000 for the first year's interest. So that will come from the developer's profit, not the fund's profit. The fund of the group who ultimately have the financial interest in there. So we have had regular reports from the developer in terms of who they've invited round. What I'm sure you can imagine is that certainly coming to where we thought we were getting to close back in February time, there were issues around the restaurant industry. You'll have known that quite a lot of the sort of large restaurant groups were starting to struggle financially, and certainly the case since the pandemic is that there has not been a significant interest in those particular units. I would be surprised if they were let anytime soon. I'm not sure if Nick has got anything he would want to add in on that.
Yes, thank you, Patrick, and good evening, everyone. As Patrick said, I mean, the national operators who traditionally take these sorts of units have been in dire trouble, and you only have to look at the number of closures and CVAs. And actually, some of that was going on just before COVID. So COVID has absolutely knocked these people for six. And so the notion of them actually being able to let the units at the moment is extraordinarily difficult. They are obviously required, as we've said, to use their reasonable endeavours to achieve those lettings, but it would be extraordinarily tough to say they haven't been using their best endeavours in a time of a pandemic. It's obviously massively stymied demand for those units, so we find ourselves at this point where obviously there's closures going on, and investment in new units for those particular chains and others, smaller, more independents, is massively challenging at the moment.
I think, I'm just checking what I can say, what was in the public domain, but yeah, the original report in 2017 did go on to say that any loss of rent to the investment fund is taken from the developer's profit. This includes loss of rent on all 3 of the East Stand units. So the developer was financially incentivized at the time. So there is a cost to them of the units not being let.
Thanks. I mean, you made a reference to that report. I'd got the report up in front of me as well, and I guess the bit that I'm just trying to understand is, that report to executive in October 2017 says that, given the developer is in detailed negotiations for the letting of 2 of the East Stand restaurant units already, it's considered low risk to go down this route. And that's 3 years ago. I'm just trying to understand, I appreciate pandemic and everything, but none of us, in sort of this time last year, it was but a sort of a blip on the horizon sort of thing. I'm just trying to understand when we started to realize between 2017, when we thought this was a low risk option and that 2 of the 3 units were to all intents and purposes ready to sign and be let, to now finding that none of them are, and that actually it's going to cost us an awful lot of money. I appreciate what you're saying about the sort of reasonableness of reasonable endeavour, or whatever words it was you used around trying to let, but we did seem to think that this outcome was a relatively low risk or very relatively low probability 3 years ago. And
all I can say there, Councillor Croshaw, is that at the time of that deal and at the time that the risk was taken to executive, the restaurant market was in a different place. There were large chains, rents were going up, they were competing with each other. It felt that it was a low risk at that time. I'm not sure when between 2017 and 2020 it started turning, but as Nick has said, a number of the large chains, who are the sorts of people who are competing for these units, were starting to struggle. Companies such as Pizza Express, the restaurant group, they've all started consolidating, so there's less demand for these units.
I think it's fair to say it's in many ways a snowball effect. So the most important part probably of that entire commercial deal was the IMAX cinema. The IMAX cinema is a thing that drives the footfall. Once you have the IMAX cinema, you then develop restaurant interest. Restaurants will not come unless there's a main driver to that site. So you kind of have to get that in place. Your larger restaurant units come in, which would have been your TGA Fridays and your Zzz's, etc., into that particular space. And then you're in a situation where you can start to look at some of the small units. So it's starting to build that momentum on the site. And so you're always going to be at a point, I think, 2 years out, where some of those smaller units were less likely to be let because people were waiting for the cinema to be finished, waiting for the larger areas to open. And then that starts to generate that interest. But it's towards the end. And as I say, as Nick and Patrick have alluded to, unfortunately, when we hit that end period, it was possibly the worst time in history to have hit that point.
Thank you, and apologies, councillors Pearson and Fenton. Thank you for indulging me in that, but I'll now take you in order. So it was Councillor Fenton first, and then I'll come to Councillor Pearson.
Thank you, Chair. This might be a question for Patrick or Nick. In the paragraph 10 of the executive reports, it talks about in October 2017 had a different decision being made. It refers to significant abortive costs. I just wondered if you could explain why those costs would have been triggered if it had gone a different way.
Well, to some extent, that decision was 2016 was where the council was effectively advised that we had spent £2.6 million at that point in time developing the community stadium and capitalised those costs up to that point in time. There was also potentially a compensation event that we would have had to have paid GLL for taking them down to a position where the stadium, all the work that they had done through the procurement, I think there was a number of 1.6 million referred to in a report in March 2016. So that £4.2 million of aborted costs would effectively have had to have been written down to revenue. Say in March 2016, that decision was taken. We then naturally progressed to a further point in July 2017 and October 2017. So at all those times, the abortive costs or the potential abortive costs were increasing if the council was to say, actually, we're not going to build a stadium. But we then also had the obligations of the Section 106 that we'd received from Vanguard, where we'd received a significant sum of money as a Section 106 for new community stadium facilities, and we would have had to go up and come up with a new solution for that, or hand the money back to the Vanguard development, which was not really in anyone's interest either.
Councillor Pearson.
Thank you, Chair. I was just wondering which of the options presented in the paper sort of present the least risk, and if the risk can be mitigated.
Well, certainly option one is the least risk, because we know for absolutely sure we'll have to borrow 1.375 million to fund the gap in the community stadium, but we know exactly what those borrowing payments will be. So that's kind of the lowest risk area.
Did you have a supplementary there, Councillor Pearson?
Yes, please. Yeah, I was wondering. I'm an eternal optimist. I know that we're probably headed for, we're already in probably, but we're headed for a heavy recession, and I generally know from reading that cinemas do well during recessions, but also, it's a relatively cheap expense that people can, generally speaking, afford. Likewise, I think we've got a fantastic new stadium, and I believe that York City will go up a league anytime soon, and I think that will attract the fans. So, so my question, I suppose, is what's the opportunity if we went for option 3, which is my way I'm thinking? What would be the opportunity cost of not having those units for rent for whatever purposes we decide?
I think that's one you might want to go into private session to discuss, because what Nick will be able to do is talk you through what the cost per square foot is, what the likely return per square foot is, what the market is telling us, which then gives you a better idea of how close you are.
We have provided information in confidential Annex 2, which which gives you the early years potential costs of the various options. So some of them have a larger early cost, which will ultimately have to be funded through the budget process. So you potentially will have to find additional resources through the budget process at a time where we know we've also got pressure on other services, but that would be a member decision.
Thank you.
I'm happy to take us into a private session, Councillor Pearson, if you wanted to go into that in some more detail, and if other members of the committee were keen to hear the numbers. I think if we were going to do that, what I'd like us to do is just ask any further questions that members may have that are suitable for the public session before doing that. So Councillor Pearson, is that something that you're keen that we do to get those numbers?
I think only if the rest of the committee are also inclined to do the same, but
I would recommend it, Chair. I think it's useful to have that conversation with Nick.
Yeah. So in which case, what I'll propose is that we move to a private session shortly, as and when we've exhausted any other questions that are suitable for the public session. I'm looking to Janie and Dawn to see whether I need to do anything other than propose that and see a show of hands that members are satisfied that we do that. That's okay. So if you can just all, yeah. So if members could just give me a show of hands that you're happy that we'll move into a private session as the last thing that we do on this meeting to ask any final questions. I think I'm seeing pretty much everybody's hands.
4, 5, 6. Yeah, there's enough, Chair.
Yep, fantastic. Okay, so with that in mind then, if members have any other questions that they want to ask in the public session, if you could just stick your hands up now and indicate. So I'm not seeing any further hands. I just had one further question that I wanted to ask, which I'm not sure whether it's a question for Patrick or whether it's a question for Councillor Eyre. I think it's probably more of a Patrick question. And it's just referring back again to the executive report from 2017, because there's a line in there that says, talking about the risk of these units not being let being considered low, but it says that if the impact were to materialise in full and the shortfall in the capital project of circa 1.4 million, in this context, it should be noted that the July 2017 executive report identified a revenue surplus of some 3.4 million across the life of the project, and some of this could be utilised should this risk materialise. Whereas, so it seems to imply that there may be a way of recouping some of that money, if I've understood that correctly. Whereas I think what we're proposing at option 1 is just that we take the full hit of the 1.4 million and then we pay it back as 96,000 pound a year on the revenue.
That's absolutely right, Chair. We will be providing an update to members at a future capital monitor when practical completion has effectively happened on the stadium. There's a lot of costs and revenues which we need to review in terms of the final build cost and the ongoing rents that we're receiving from the partners. So that will be part of a sort of separate update through to members, which we haven't got at this point.
Okay, thank you. So without any further questions, I will suggest, sorry, Dawn, did you want to make a comment?
Yeah, I just want to say, Chair, just before you go into private session, you'll probably need to come back out of private session to convey your public decision after that, just to be mindful of that, that's all.
Okay, I'm not sure that we are looking to make a public decision, are we? Because I think that this was a report for us to note and give comments to feedback, but I'm not sure that we're...
Well, any comments that you're going to feed back, I would have advised normally, I don't know what Janie thinks, but that you make those in public session, unless there's something that you feel you can't say, you know, obviously
Sure.
you can do that in confidential session.
So I'm just trying to think, so in terms of us flipping in and out, and what's the most constructive way of managing this. I mean, my view would be that, broadly speaking, I think if we're going into the private session to discuss some of the finer points, they may not necessarily be things that we would want to be conveying sort of to executive or what have you. I don't know if other members have any thoughts on that. My thought overall, sorry, Councillor Eyre, I'll bring you in if you want to just add your thoughts.
Yeah, I don't think you can sum up until you've discussed the figures. I think it would be premature to do that now. I take Dawn's point, but this is going to executive, so it will be minuted, and we'll go through as a report to exec that this is what Scrutiny said. So I don't think it necessarily needs to come all the way back to switching the webcam on. Can just be a written update to executive.
I'm just thinking how you would normally conduct that if you were holding a physical public meeting. Think about how you do it. I
think I'd like us to be as open as we possibly can be. So can I suggest that we move into a short private session, ask any questions. I'm also very conscious that I did say I was going to guillotine the meeting at 8 o'clock, and we're now at 8 o'clock. So apologies to everybody. What I suggest we do is go into a private session now. It'll be a brief private session. We'll then return to a public session just for a very brief summing up of where we are, and then we'll bring the meeting to a close. So I'm waiting for the technical officers to, I'm assuming that we joined a breakout, do we? Or Okay, welcome back to this evening's meeting of the Customer and Corporate Services Scrutiny Management Committee. We just had a short private session, and we're now just coming back to invite any final thoughts from members of the committee as to any comment that they may wish to make on the report and options that are going to executive on, I believe, the 15th of December. So I'm just looking for any hands if anybody had anything that they wanted to add or comment, and then I'll perhaps give you my thoughts as well. So Councillor Taylor.
Thanks, Chair. I mean, none of the options are great. I think everyone gets that. I wondered if whatever we say, I mean, I'd like us to say something like, rather than saying we support one option or another, we might recognise that option one is the least worst of the three. That's just me, though. I don't know what colleagues think.
Councillor Fenton.
Yeah, I think in a similar vein, in terms of the option that would expose the council to the less risk, I think option one, I'd sort of couch it in those terms, in terms of having having looked at the potential consequences of other options, that come to the conclusion that option one poses the least financial risk to the council going forwards. On that basis, I'd support it.
Thank you. Any other thoughts or comments from committee members before I chuck in my 2 penneth worth? Councillor Pearson.
Just to say that if it was left as me, I'd go with option 3, but that's hey, I'm a risk taker.
Thank you, Councillor Pearson. I mean, I think it's certainly encouraging to hear people thinking in longer terms than, you know, just this year, next year, or even in the next 5 years. You know, I think one of the challenges of local government is to think longer than your own term of office or your own sort of likelihood of seeing some of the benefits, because we are, you know, we're custodians of the city and all that sort of thing. I mean, my view would be that, you know, as has been said, it does seem to me that there really is only one choice going forward. And actually, if the developer hadn't have perhaps approached the council with options 2 and 3, we wouldn't even be necessarily having this discussion. So, you know, in that respect, I think, you know, in a way that there is no other option than option 1. The one other comment I would have is that I do think it's worth us considering it as a bit of a salutary lesson, because I think it's been quite clear that this has been a long saga that's, you know, as Councillor Eyre pointed out, you know, started perhaps almost 20 years ago and has spanned a number of different administrations, and there's been a number of different decision-making points. And I'm just mindful of the discussion that I was party to at Audit and Governance last week, talking about York Central and some of the decision-making and risk-taking and risk management of that, and where you get that cumulative decision making that leaves you in a situation where actually 5 or 10 years down the line, the abortive costs are so great that the only option is to keep going forward, when actually, had you have known then what you know now, that sort of thing. Not saying that that's the case necessarily with this particular decision at this particular time, but I do think it is something that we all as councillors need to be mindful of. We can't predict the future, but we do sometimes, I think, find ourselves caught in a bit of a catch-22 of there really not being a single good option, and it's always better to try and positively take a good option than have to take the least worst option. So that, as I say, that it seems to me that there is no option other than option 1, but it is perhaps something that we all ought to keep in mind when we're taking other decisions about some of the other big capital projects that we're involved in. I think unless anybody else has anything else that they wish to say, or anything in response to that, I think if we can ask that, broadly speaking, that's summarised and sent forward to executive as you know, our thoughts being as those of us who've articulated them are. And other than that, all it leaves me to do, I think, is wish you all a very Merry Christmas and a Happy New Year from Customer and Corporate Services. and to thank all the officers both on the screen and off the screen who've supported us this evening, and I look forward to seeing you all very soon. Thank you very much.